Good evening, you're watching the Daily News Bulletin. I'm Navya Singh and I'll take you through the most important headlines of the day. Let's begin. Let's first begin with the COVID-19 updates. Even as the country's coronavirus tally continues to rise and has surpassed the 55 lakh mark, what's good is that over 1 lakh COVID patients have recovered of the deadly virus in the last 24 hours. The country added more than 75,000 fresh infections and over 1,000 deaths in the last 24 hours due to COVID-19. Remember, ladies and gentlemen, this is the fourth straight day when the number of daily recoveries is much higher than the number of daily COVID cases. The number of active COVID cases in the country constitute about 17% of the total coronavirus cases in India. Shifting focus to the Farm Bill, the government on 21st of September announced an increase in the minimum support price, which is the MSP, of key winter crops amid increasing opposition and protests by the farmers who feel that the MSP system will be scrapped under the new farm laws passed by the parliament recently. Now, the hike came days after farmers' protests and also protests held by the opposition, and also the time when the PM Modi government gave constant assurances that the MSP will not be removed. PM Modi also called the decision of hike a very historic moment for the country. Now, the hike in the MSP includes wheat, which is a key crop in Punjab and Haryana, which is also the epicenter of the farmers' protests since the past few days. The MSP of wheat has been hiked by rupees 50 a quintal, which means the crop will now be sold at rupees 1,975 per quintal this season. Remember, ladies and gentlemen, the wheat MSP has been hiked by only 2.6%, which is the lowest in 11 years. In another major news, the Parliament on 21st of September, which was yesterday, passed a legislation that provides up to 7 years of imprisonment or jail term for attacks or violence against healthcare workers and healthcare professionals who are fighting the COVID-19 pandemic or any other similar situation. Now, the ordinance was introduced by the Centre in the month of April this year to amend the Epidemic Diseases Act 1897 that aims to make attacks on healthcare professionals a non-bailable offence with a hefty penalty of a jail term of up to 7 years and a very heavy fine. Health Minister Dr. Harshvardhan said that this is an empowering decision, and he also said that states will have the power to make additions to the Act. In another major news, the government has told the Supreme Court that the electronic and the print media very rarely cross the line. However, it is the digital media that continues to be unregulated and uncontrolled. The Ministry of Information and Broadcasting has told the Supreme Court that if it considers it necessary to lay down the guidelines for electronic and print media, the practice should first begin with the digital media. Now, remember, ladies and gentlemen, the Supreme Court is hearing a petition pertaining to the Sudarshan TV's Bindas Poll show on the infiltration of Muslims in the UPSC exams. In the affidavit filed by the government, it is mentioned nothing is required for accessing digital media except a smartphone, as against the limitations in the print and the electronic media. In a letter written to a group of United Nations human rights experts, Dr. Kafil Khan has mentioned that he was physically and mentally tortured at Mathura jail, where he was lodged under the stringent National Security Act for giving a provocative speech at Aligarh Muslim University last year during the anti-CAA stir. Dr. Kafil Khan in his letter has mentioned that he was tortured mentally as well as physically. He was denied food, water for many days, and he was also assaulted in the overcrowded Mathura prison. Dr. Kafil has also written in the letter that the use of stringent national security laws, right from the NSA to the UAPA, which is the Unlawful Activities Prevention Act, against political dissenters in the absence of any appeal is something to be condemned in all the cases. That's all for today. I'll be back with some more important news tomorrow. Thanks for watching.